who agrees to give birth to a child resulting from artificial insemination or implantation of an already fertilized egg, and who surrenders any parental rights to a third party. For more on these different fertility options, we are joined by Dr. Lawrence Gobetz from the Vitalab clinic. Doctor, thank you very much for joining us.
Thanks, Sam.
I know we are talking about different options when it comes to bringing a baby into this world, but this process of fertility, are we seeing an increase in people that are struggling to fall pregnant, or are we kind of on the same path for the last couple of years?
There's definitely an increase based on, firstly, we have an incidence of a condition. Infertility is an illness. Okay, it's not plastic surgery or anything like that. So as the population grows, 10 to 12% is now, you have a bigger slice of a bigger pie. Although that 10 to 12% seems to remain relatively constant throughout the world, but we are seeing a major increase related to the fact that women are delaying their childbearing. It is no longer acceptable to be having your babies when a woman is her most fertile, and that is somewhere between the age of 16 and 24. So today, as we've spoken, women go to varsity, they establish themselves in their careers, they become financially stable, they then find Mr. Right. Mr. Right is tested first for a minimum of 2 years. I always say it's like a computer. When the computer's broken, we throw it out, we bring in the new computer. So, you know, marriage today is almost a disposable event, which it shouldn't be. But the problem is, the single most important factor is age of eggs, and that is something we can't do anything about.
But we don't talk about the age of eggs. I've never heard anybody talk about egg preservation and looking at how matured the eggs are of a woman.
As a woman gets older, she's born firstly with a total complement of eggs, which at birth is somewhere in the region of about 2 million eggs. When she gets to her first period, which is puberty now, she's probably got about 300,000 eggs left. And as she gets older, the eggs that she is releasing in that month is equal to her age plus 9 months, because those eggs were already in her ovaries when she was in her mother's womb. So eggs get older with the female. Sperm does not do the same. Testicles have got stem cells. We make new sperm every single day, as I said, until our finality on this planet. Unless we have a vasectomy, obviously blocking the sperm from getting out, but the testicle will still continue to make sperm for the life of that male patient.
We're talking about different issues related to fertility, but there are also different options now. Some have mentioned is surrogacy, is artificial insemination, all of those kind of things. But that in itself, as a final destination, is quite an emotional process. Because, as you say, that expectancy up till 24th, up to the age of 24, you're quite fertile. After that, you're going into some kind of degeneration of a fertility process. Are people prepared for that? When people say we can't have children, do they understand the process after that?
Sam, when they find out that they can't fall pregnant naturally, they have a total loss of control over a very basic element. And for them, it's a death. It's an absolute death. And they mourn this death. And then for a woman who thereafter every month willing and hoping she's pregnant has another period, that for her is another death. And the women actually grieve it very differently to the partners or to the husbands. So for them, it's an amazing, difficult time that they go through.
Well, it's also a question about their own womanhood.
Absolutely, their own womanhood. And also, you know, if you really tell a man that he's got no sperm or his sperm is very weak, for him it's a major ego issue. So there are a lot of things from a psychological point of view that we address. So we don't just see the patient as an egg, sperm and a womb. So we have counseling facilities and we get into that at top level. But the biggest problem I think we have in this country is that patients unfortunately go from pillar to post. And they get the wrong advice and they undergo the wrong tests and very expensive tests. And they have, like a female goes and has a laparoscopy. Okay, why? Because the gynecologist sees that as a means to earn an income, not to see, well, why am I really doing this on the patient? So my warning to patients out there is, rather than go on this emotional roller coaster and inappropriate evaluations and inappropriate tests, which cost thousands of rand, and risky procedures like laparoscopies, they should go and seek help from proper fertility clinics in this country and not mess around. And that is the take-home message. If you're over 32, do not mess around.
Infertility, I mean, how challenging is this? Just give me a sense. I know you're an expert, you deal with it every day, but for people to understand, when somebody is infertile, when they struggle to fall pregnant, medically, how difficult is it for the body then to shift?
Medically can be sometimes very simple. There may be very simple issues that we could sort out very quickly, versus there could be very difficult circumstances where the time to pregnancy in a good fertility unit can be somewhere between 9 and 12 months. So it can vary from getting them sorted out within 1 month to 6 weeks to sometimes up to even 2 years, depending on circumstances. And that is a very difficult ride.
Doctor, we're going to leave it there. We've run out of time. Very interesting conversation. We're talking to Dr. Lawrence Gobetz from the Vitalab, and he's talking about fertility and some of the important decisions that couples have to make. For more information, please log on to their website. It's www.vitalab.com. We take an ad break. Don't go anywhere.